Dr. Minhaj Bhuiyan from National Institute of Cancer Research and Hospital. I'm going to present my topics on oncoplastic surgery for breast cancer, median 2-year follow-up results. Oncoplastic surgery for breast cancer is an integration of scientific principles of oncological surgery with aesthetic techniques of plastic surgery to give better outcome to breast cancer patients. The main goal of oncoplastic surgery is, better cosmetic outcome, avoid mastectomy, and overall satisfaction and quality of life. There are several issues that has been encountered in oncoplastic surgery: margin, local recurrence, oncological outcome, delayed in adjuvant therapy, and missing recurrence. All those issues are well encountered in oncoplastic surgery in comparison to the conventional surgery. As you see, for marginal status, OPS has better marginal clearance than that of the conventional. Although the local recurrence is a bit higher in oncoplastic surgery, but this is not significant statistically in comparison to conventional group. Overall survival and regional and distal metastasis is almost same in both techniques. There are several levels of oncoplastic surgery: level 1, level 2, level 3, and level 4. I'm not going to details of that. And oncoplastic surgery can be performed in various techniques: by displacing method, by replacing method. So for oncoplastic surgery, level 1 and level 2, and we in our study adopt level 1 and level 2 oncoplastic surgery. As you know, this is a very crucial chart: when and how we perform, in what percentage we perform this oncoplastic surgery, in which level, in comparison to the breast size, tumor size, and volume. We perform, let us see some examples of our performance in oncoplastic surgery that we perform in cancer hospital, in other hospitals. For upper quadrant, we usually go for Bhuiyan mastectomy. This is the example of Bhuiyan. We also go for hemi-Bhuiyan for upper quadrant tumor. And this is one of the example of 9 months after the surgery. You can see the almost same, aesthetically same results. We also adopt the cross techniques. We also go for parallelogram. This is 10 months, 10 post-operative result, and this is after 12 months follow-up after getting radiotherapy. This is 12 months radiotherapy. Let us see some example of outer quadrant tumor. We perform lateral mammoplasty for lateral quadrant. Inner quadrant, we perform bracket mammoplasty. Upper inner quadrant, and this is a very challenging area, For this, we also perform the matrix rotation techniques. This is the final results of after operations, and this is the follow-up after 3 months. Lower inner quadrant, we also adopt beam mammoplasty. For periareolar, we perform round block techniques. Crescent mastoplasty. This is after surgery and after 12 months down the line. Inverted mammoplasty. This is one of the example of inverted mammoplasty after 12 months, 24 months follow-up. J mammoplasty for lower inner quadrant. For central quadrant, we adopt Grissotti techniques, and we also keyhole shaped amogram door flap also for central quadrant tumor. For outer quadrant, we adopt some perforated flap based techniques like a this is the preoperative detections of the perforated vessels and after harvesting the muscles, dermagandula flap. So we perform round block to keyhole techniques at 14 techniques in several series. In short, in our series, we have shown that we have performed 58 patients coming from September 2021 to February 2022. And we adopt 14 techniques and our follow-up time is 19 to 27 months. That is median follow-up time is 24 months. And we encountered 4 complications. Our endpoints, primary endpoint was cosmesis and recurrence. Like secondary endpoints was quality of life. We have some variables for cosmesis. Also, we see the 4-point Likert scale, where we consider ipsilateral shape, cleavage, curve visibility, and symmetry. For recurrence, we look for local, regional, and distal metastasis. And for quality of life, we look for body image, fear of recurrence, patient satisfaction with treatment, and cosmetic result. Let us see the results. For cosmetics, we have divided 4 points into 16, and this is the chart. You see, poor, fair, good, and excellent result. If we summarize, we found good 32 patients and excellent 58 patients. That is 90% patients is in the group of good or excellent cosmesis. For recurrence, we have 3 recurrence. One regional, that is regional recurrence. Another 2 is local, that is regional, local plus distance metastasis. This is the example that we have seen. We perform the keyhole technique for central quadrant. The patient come back to us 21 months after with a recurrence in the axilla, but the local site is almost okay. We do metastatic workup. We don't find any distant metastasis, only the local recurrence in the axilla. So we perform after 21 months, we just perform the axillary dissections. Previously, it was sentinel lymph node dissection was only performed for this particular patients. Now we do the axillary clearance. This is another example of local distance. This patient was performed wide local excisions, but the patient come to us 24 months after with the local as well as vertebral metastasis. So this time we go for recurrence. This is the 5.1% recurrence. You see. The recurrence rate is 5.17%. Regarding quality of life, you see highly satisfied and satisfied group is almost maximum. And for fear of recurrence, for fear of recurrence, we see 80 to 90% score is 3.4% and 70 to 79 recurrence 17%. So, and patient satisfaction with treatment was highly satisfied was 84% and average satisfied is 14%. Cosmetic result highly satisfied 80% and satisfied is 20%. Quality of life, if you consider quality of life, you see that 57% is satisfied and 99% is satisfied and fear of recurrence is 20% is satisfactory and satisfaction with treatment is 84% and cosmetic result is 80% satisfactory. So in conclusion, we can say in our 2 years follow-up, oncoplastic surgery is safe and feasible for Bangladeshi breast cancer patients and it should be the standard of care in breast cancer surgery when appropriate. It is still under practiced, though it offers better cosmesis without compromising the oncological safety. Basic oncoplasty to advanced oncoplasty to extreme oncoplasty is the learning curve. In the last session of this, in the last year, we present the 1 year follow-up of this our study, and this is the 2 year, and we hopefully will expect that inshallah we can present 3 years median follow-up with survival of 3 year and recurrence in the next oncological congress. So up to this, thank you all.